call the meeting to order. And good afternoon, everybody. This is the Wednesday, May 5th. May 6th, 2020 Board of Health meeting. Just like to remind everybody that this meeting is being recorded by video and audio, and under the current state health emergency pursuant to the Governor Baker's March 12, 2020 order open meeting law, provisions have been provided to conduct these meetings remotely. So just to say who's present by roll call, could you just say whether you're present when I call your name? Helene Weld.
Present.
Matt McNabb.
Present.
James Cooper.
Present.
Reed Higgins.
Present.
We also have Greg Corbo from Town Council.
Present.
And Jeff Carlson from Natural Resources. One thing that we won't be doing in this meeting today at 3, but we will in the joint meeting with the select board, is be taking public comment. So that said, I'll just we'll go to Roberto with any updates.
Okay, so real quick, I'm just going to do a quick update on where we are right now. We're looking at a lot of the permitting issues, including the lodging, the food, the restaurants, lodging, dorms. It's all of the things right now that we're trying to get guidance together, waiting for guidance from the state and things like that. In your packet, you have a presentation report that was given by the COVID advisory group, COVID advisory task force, I think is what they call themselves, regarding some projections that were given. So in order to properly explain that projection, I would actually like to give a quick PowerPoint presentation. It's a few slides here to just kind of explain what you're going to see and what you see in that report, and because there's been a lot of confusion and a lot of pushback from what was written. So if you don't mind, I can go ahead. So let me share the screen. Okay, can you see my desktop here?
Yeah.
Yes.
Okay. So what you see in front of you right now is just a quick, I'm sorry, this is supposed to be a PowerPoint on my side, but with the link, something happened with my computer and we couldn't connect through my computer. So we'll just go from what we have. So what you see in front of you is a quick COVID-19 spread projection that was developed by the advisory task force for presentation to the Board of Health and Board of Selectmen. Real quick, in a quick summary that we're finding is that in early mitigation, if it puts place well done, we did very well in putting mitigation in place. And what that did prevented any sort of spread on any local spread on the island. We had 13 cases here. For some of that demographic information that we're able to give out, of those 13 cases, about 1/3 of them were laborers, and more than half of them were Hispanic. We are requesting information from the state on this so that we can get more of their demographic information, find out what the work and if they work in construction, landscaping, which was the question that was out. Just a real quick background on the epidemic calculator that you're going to be hearing a lot about. It's Gabriel Go is a mathematician from UC Davis, and he works in OpenAI. He developed a interactive model of an epidemic curve in order to calculate where it goes. And the calculator you see is using the SEER compartmental model, which is based on the Kermack-McKendrick theory. This theory is one of the compartmental models that we use in epidemiology. There are many different types of models out there. SEER is just one of them. But one of the things that's very important to remember about modeling is that when we're modeling epidemiology, we're dependent on behavior. So whether we adhere to mitigation standards or whether the bulk of the people don't, that can alter the model going up or down. So what you'll see in the report is some basic model assumptions. Globally, what you're going to see is that COVID-19 has an R, which is the replication rate of 2.2, which means for every one person infected, on average, 2.2 other people get infected. In Massachusetts, we're seeing an effective R value of 1.8. There's approximately, using the data that we have, an incubation period of 10 days with an infectious period of 10 days. Incubation of 5, with an infection of 10. And what you're seeing in the state is case fatality rate of 5.4. But we do have to remind everyone that the 5.4% case fatality rate that we're seeing is also because in Massachusetts it's skewed upward due to the large amount of infections done at nursing facilities, which is a highly vulnerable population. So what you're going to see, there's a couple models written in the report. I picked out the population of 28 because that is more or less what we see here in the coming month or so. Intervention, we have it set. So on day one, on May 1, that will be day 40, which is when the intervention was set up. What's really important, you'll see two circles, one on the left and one on the top. That what you're seeing is an R in Massachusetts of 1.81, but that is on a linear, that is not on a linear side. So you'll see on the left that green is recovered, hospitalized is the light blue, and fatalities is the dark blue. And what you're seeing is just in general, a general upward trend of cases, fatalities, and hospitalizations. In the report, there's an approximation that there will be 65 or greater, maybe even up to more than 100 deaths without proper mitigation. So what can we see if there is proper mitigation? Things like preventing certain types of work, preventing a lot of the transient population coming back and forth, things like that. So if we do have a mitigation model present, we can probably expect a model, an R of 0.9 or so, which is when it's a propagation of 1 means that the virus will continue on in the population. Anything below 1 means that it will eventually slow down. What we're trying to do in order to save lives is what you're hearing, the term flatten the curve. You're hearing things, we hear the terms flatten the curve nationwide. This is what a flattened curve looks like, and this is with severe mitigation. So, and you'll see on the left side, this is actually on a linear scale of a non-linear scale of up to about 100. So that's when you'll see the more or less flattened curve. That's kind of the gist of what we're seeing. What's really important though is the recommendations that are coming out of here. what you're seeing is a recommendation from the report to return to strict level mitigation. What you're seeing, what we have now, if we were continuing that mitigation, if we continue not allowing certain work and incredibly strict interaction, that's what you see here, which will keep the number of people on the island down as few. Some of the most important ones, though, is that we need to have some sort of an active level surveillance. That is something that we're working on next. I know the hospital wants to set up some sort of a active surveillance program in conjunction with MGH and Harvard, and we're trying to get information. I think the biggest setbacks on that are funding being perhaps the biggest one. And we need to organize some sort of an educational campaign. The name being thrown out there right now is Keep Acts Safe. This is coming from the advisory board, but I believe that it's something we were already looking for. We just need help in organizing it. And what you're already seeing is required face masks. We're going to have to see this for the foreseeable future. A lot of the projections you're seeing on the news, as well as from the CDC and WHO, is that this is going to be a long-term event, anything from 18 to 36 months. We're going to see intermittent face masks, hand sanitizer, extreme social distancing in public and recreational areas. And then if we do see outbreak, a large-scale outbreak, something as severe as a lockdown again. There's going to be a lot of conversations about this over the next week or so that you'll hear from about this. But I just wanted to give you a quick update. The report is in the packet, and really quick, just wanted to see what you had as far as questions.
Anybody want to start? Malcolm, maybe?
Sure. Am I on?
You're on.
All right. Can't quite see. I'm just going to read some comments, if that's all right. So I certainly would like to thank the group for their work. I think modeling is difficult and requires the correct assumptions. The problem with COVID-19 is that we actually know very little about the virus, at least if we compare it to influenza. The CDC uses modeling for influenza, but it's tested with years of experience and adequate data. We actually use modeling on Nantucket. We use it to evaluate the nitrogen in our ponds and harbors. A well-established model that uses specific measured nitrogen. So there is no guessing about the measured nitrogen level. So what does one use for COVID-19 model? What do you use for a model? Well, some of that was mentioned in the assumptions that Roberto presented, but what is the true infection rate? Not just those tested, but those that actually have the virus but have not been tested or have low symptoms. And what is the true death rate? And this is really important because the emotion always comes with the death rate. How can we tell what that is if we really don't know the true incidence of disease? You have to have an incidence of disease to figure out the death rate. And of course, are there differences within the models based on age? And importantly to the island, are there geographic distances? Jennifer Nuzos, a senior scholar at Johns Hopkins Center for Healthcare Security, is actually quoted in yesterday's Wall Street Journal. And I would suggest you all read that article. It's quite interesting. She says, models particularly related to this virus are only as good as the underlying data. And the underlying data is flawed in a number of ways. That said, we can't throw out the models. We still need to make decisions, and having tools to guide the decision-making is helpful. Some obvious questions, and there's probably 100 of them, but just a few of them. Why was this particular model used? There are a lot of models out there. In fact, MIT is presently developing a model, but some of the famous ones come from the University of Washington that has been criticized. Columbia University, Johns Hopkins have all been criticized, so I'd like to know a little bit more about this model. Are the assumptions correct? Were there sensitivity analyses done? And can you form an adequate estimation on a relatively small, non-stagnant population? I compliment the effort, but we must be very careful not to base our desired facts on conclusions. It should be the other way. I do not think it would be too productive that we have this discussion for a long time. Of course, I can't prevent that, but I think it would probably go around in circles. My 40 years of reviewing scientific and medical data has made me a skeptic, and some say I'm probably too much of a skeptic. There is no one on the Board of Health or the Select Board who has the experience to accept this report outright or even not accept it. I know the questions, but I do not have the skill of how to respond to the answers. The Director of Public Health should send this analysis to the State Director of Public Health for comment. I also understand the state is doing modeling. To what extent? How does it relate to Nantucket? And Matt has frequently talked about the elephant in the room. The elephant in the room is what's the degree that we shut down the during the summer. Certainly, no one can argue in buildings, and there is passion mixed, unfortunately, with a significant amount of fear on this issue. It is very difficult to make decisions without some bias. That makes us human. That is why we should have an unbiased, non-Nantucket input about the comments.
Anybody want to comment? Jim or Helene? Rita?
I'd like to hear from Roberto because I certainly am not knowledgeable on this subject. So I think he's me.
I think these are actually great points. This is a model that was created, that was used as it became available, to my knowledge. It's not vetted to my knowledge, but I do know that that we have some vetted groups that are looking at this calculator. But other than the regular SCIR model, I don't know where else this calculator has been used. As far as going out to the state and waiting for the MIT model and the key model, you're absolutely right. All models get criticized. All models go forward. I think one of the things that we need to go forward is using, more than anything else, just the information we have at hand. But I agree. I think Malcolm has actually some very great points, and I would like to go back and get more information on it.
Greg?
Thank you, through you, Mr. Chair. I appreciate being able to participate in this portion of the proceeding, because it's good to understand what the background is for the basis of your action. And this is certainly a novel situation that we find ourselves in, and it's one in which you're not likely to find perfect science. For every one study or model that says one thing, you may find another study or model that says something else. And so, for purposes of the board's discussion, you don't necessarily have to get so bogged down in the details of the science. From a regulatory perspective, the standard by which the board's actions will be judged is whether or not they are reasonably related to the protection of public health and safety, and whether the means chosen are reasonably likely to achieve the desired result. Now, it being a reasonableness standard means that a couple things. First of all, in protecting public health, you're not required to wait until the danger materializes. So you're entitled to take certain actions to prevent a harm from occurring, not just in reacting to a harm that has already occurred. The other thing is that you're not required to have absolute scientific perfection. Rather, it's, would a reasonable person in your position believe that the action you're taking is likely to have a positive impact on public health? And that goes for not only the basis for taking the action, but also the means that are chosen. And so, here, what we've been talking about over the past few weeks has been a phased-in approach to reopening, in this particular circumstance, construction and landscape activity on the island. And the basis for that is sort of based on the assumption that the less people you have coming in from off island, the less likely it is that the disease is going to spread and propagate here. And so, the question that you have in front of you is, are the steps that you're taking reasonably related to the protection of public health? And I think in this particular circumstance, is it still reasonable to start to dial back some of those restrictions? And, last week when we were on the call with the Board of Selectmen, we heard from a representative of the hospital who indicated that they have the capacity to handle these cases if they're going to come. And that's certainly one component of it. But, preventing the cases from coming in the first place is another component. So, I guess at the end of the day, we can look at the science and we can try to use the science to guide your decision making. But I wouldn't be, at least I don't recommend that you get handcuffed by it and, wait until you find the perfect solution, because I honestly don't think it's there, and it's not likely to come in time for you to do anything constructive.
Welcome.
Well, I agree with almost everything you said. We have no manual for this. And if you ask 6 experts, we'll get 10 opinions. We all know that. And we have to be very careful. We have to make our decisions. And I'm not sure it's the time to get the foot off the brake that much. And that will be interesting in the next discussion. My point is we should not, actually, I'm agreeing with you. We should not get hung up on science too much, because there is not very good science at this time. I want this report, which I think people spend a lot of time on and a lot of effort, and may be perfectly valid. I think it's very important we have someone without Nantucket connections evaluate that. That's my point on what I was trying to make. I may have wandered on a little bit about it, but I think that's what we need to do. And we can talk forever about whether it's a good report or a bad report or what should we do with it. Let's just focus on getting that vetted properly, and then we'll go forward and make the best decisions we can with the limited information we have. And we will do that. Science is not always very good. As I said, I've spent a lot of years. My basic job was, for the most part, looking at scientific data, medical data, and I've seen so many times where something that was proven, that was great, that was going to cure mankind, it was wonderful, turned out to be not so true.
Let's start with Rita. Go ahead.
I just want to address some of those comments because it's come up at the select board meetings. Again, where do we look for? I think we've really gone from the emergency phase, where the hospital was leading us, and now we're in this transition phase where, to Greg's point, there's a science and a science element and a public health element, and there's the hospital element, but now we're really looking at a broader picture. And to your point, Malcolm, I think the board is looking for that, who is going to guide us on the science end, not because they're going to tell us exactly what's going to happen, but to give us the advice that we need. And we haven't done this before, so we've got to figure out who is that unbiased source, who can we hire, who can we talk to, but also, acknowledging that at this point in time, Roberto he is our epidemiologist on staff with the interest of the town in mind. So I think, I would look to Roberto to at least start us in the direction of where do we go to get the advice that we need. But I agree with, your point about there are many different models. As someone who has nowhere near even a modicum of the experience that you have in the scientific world, I mean, it's coming at us from every different direction. So, someone recently wrote to us about having analysis paralysis, and I think that's what we want to avoid. And although, going with your gut doesn't feel always the appropriate way to make policy, I think we're in a situation where we've got to look at our regulatory, what's within our purview, the science that we do have, and be reasonable about it. So I do want to say that I think your concerns are going to be addressed. And I think, again, this is happening so quickly. It's just trying to get the right people and the right pieces in place as we go. And it's something that Dawn and I have spoken about today, and the board, I know, is concerned with as well.
I think I agree with you. We have on staff on island a professional who's trained in public health, who's trained in epidemiology. And I think right now, he is our science director. He knows an awful lot more than I do about epidemiology. As I said, I know how to ask the questions, but I have no idea how to respond to the answers. And I think Roberto can do a much better job than I have. So I think it's time that the way we go forward is we listen to Roberto's advice. We still have to pay attention to the hospital. We have to understand, no matter what we do, whether we put a fence around the island, we shut the ferries down, we will still have COVID-19 on this island, and we will have it forever. The question is how we deal with it and how we manage it. So a lot of communities don't have the problems we have with our hospital capability. So to me, the way we go forward is to be guided by Roberto, and always in the back of our mind, knowing what is the capacity of the hospital. And an interesting question, it's kind of a philosophical question, maybe it's a scientific question. What is the degree of infection that we will tolerate on the island? Is it 1 case? Is it 20 cases? Is it? I have no idea what the answer to that is. And we'll be forced a lot by what the capacity of the hospital is. But say if the capacity says, well, we can take 20 patients or 40 patients, well, that sounds like a lot of patients to me. So that sounds like we should be going basis on the capacity of the hospital. We have to find some balance between. It's Roberto's. We're here to set policy, but our real input is going to really be from Roberto right now. He's going to have to filter all the experts. I once said I was an expert on experts, and sometimes you need an expert on experts. So right now, to me, my recommendation is we let Roberto guide us until he has other input.
Yeah, go ahead, Roberto.
Thank you. That's a huge vote of confidence. I appreciate that. I think what comes to mind right now is actually I think it was I can't remember who the quote is attributed to, but it is actually said that the best decision to make is the right decision. the bad decision to make is next decision there, second best. The worst decision to make is nothing at all. And honestly, just like Rita was saying, this parallelization by data is actually very real, very important to take into consideration. So I'll do my best to create our policies here, and I'll reach out individually as I need the advice here. And I think moving forward, one of the things that's really important to take into consideration is how important it is that if we do know, we have to really pay attention to our rules and our mitigation. There is always a conversation about how, do we want to be stricter than the governor? Do we not want to be more strict?
I have to take a call. I'll be back in a minute. It's very important.
Yep.
Do we want to be more strict than the governor or not? And that's the policy we need to stick with. We really, as we start looking at where we are, as we start looking at the data, as we start looking about where we are in the outbreak, that's the most dangerous thing we can do is nothing. So I think one of the next step and the most important thing that we need to do is start looking into surveillance, that active surveillance portion, to identify an outbreak. If we do get an outbreak here, when we do get an outbreak here, we'll save lives. And I think that's the most important part, getting active surveillance. But I will move forward with myself going forward. I think there's been a lot of questions about where this advisory council or group or whatever we want to call it came from. And just a quick modicum of background. After the select board meeting on Wednesday, on Thursday morning, I received an email asking to be a part of a Zoom call with a group of people. And Thursday afternoon, I was part of that Zoom call. By Friday afternoon, it had become this advisory group that was calling itself the Brown Shoe Bunch. So they called themselves the Brown Shoes, and they were trying to provide me information, helping me write reports, getting data together to present to the board. Since then, I have received a lot of a lot of questions about this group. So I want to see if the board. I want to see if the board wants to continue that group, if I should continue working with them, or if we should go through a more formalized vetted process. As of right now, it is a group of volunteers on the island that are trying to provide information, but I do understand how important in vetting this information can be and will be, and I want to get at least some guidance from the policy side here from you to see if we need to formalize any of that information, any of that group.
Would you envision this as an ad hoc committee, advisory committee ad hoc to the select board?
Well, for the select board, they would have to make that decision. Honestly, I think if the more information we get, it's a tool. It's a tool. We have information, and then as a board, we can use that tool, accept that information, or question it or not question it, anything like that. And I think that's kind of where it lies. I believe that if we can bring in one of the major schools of public health, Hopkins, Harvard, Yale, so anyone like that, I think those will probably be more acceptable to the board.
I think that would be helpful. There's a credibility to provide credibility. Yeah.
Oh, I would support that if we're saying that Roberto is a vetting guru of information. I just think it should really be an advisory board, the Board of Health, more than to the select board.
One of the things that's really important as well is I will funnel all the information as I can, and I'll be getting as many of I will try to get a weekly report to you now from me to the Board of Health and the Select Board. from where the data is, where the outbreak is, to be that clearinghouse of information, so that, as Greg says, we can just move forward with the correct information, so that we're not paralyzed and slaves to it. Like we said in that quote, where I know I quoted it terribly, but the worst thing we can do is nothing.
Greg, did you want to say something?
Yes, thank you, Mr. Chair. Well, this is not necessarily a legal observation. I'm not sure who it is that is on the committee that prepared this particular report, but I think that if you're going to be taking reports and recommendations from an ad hoc committee, you want to make sure that you have a good cross-section of the community, because data can be skewed, and people have their own motivations for either wanting the island to open more or not wanting it to open more. And with respect to this particular document, and with all due respect to the people who prepared it, it's of concern to me that it says in bold letters, is it worth opening the island for 2 to 3 weeks of normal commerce and cause an additional 75 or more deaths over the summer? That sort of makes it sound like you're responsible if people get sick. And as the Board of Health, you are not responsible if people get sick. There are a number of considerations that go into regulation, and certainly the protection of public health from your perspective is paramount, because you are the Board of Health. But public health involves all aspects of society. And, I wouldn't expect that the board would eliminate all safety measures, social distancing, wearing masks, self-quarantining when appropriate. And, people are able to be responsible for themselves, and to some extent. So while the board can impose regulations, the safest thing to do would be lock it down and say no one can leave until this is over. But that's not necessarily a reasonable response. And, your response needs to take into account all of these other factors that, go to not only health, but, social and economic factors that have an impact on people's health. The inability to work may have adverse impact on people's health. The inability to make a living at a seasonal business that you have, may have adverse impacts on people's health. And while I'm certainly not advocating one position over another, I just want to be sure that the information that you relied on comes from the appropriate cross-section, so that it's not skewed in favor of any one particular view.
Malcolm?
Oh, I'm sorry. Well, I can see why Greg is a lawyer and I'm just a simple scientist, because you certainly are much better with words than I am. You're excellent. And I share your same concern, and I kind of downplayed it in my little speech. And I was quite upset with that. If we don't do anything, people are going to die. And that's why I was talking a little bit about biases, and, that's why I'm concerned scientifically for the report, but I'm concerned there may be some bias to it. And if you picked another model, it would have been different. That's why it's important that we move on. And if Roberto has this group, I agree with you. I think you have to look. What I would suggest is you almost disband that group and Roberto select his own group.
Yeah, I would agree with Malcolm and everything that Greg said. And I'm, if anybody knows me, I'm not a big fan of the word assume. And you all know what the saying goes with that. So this is an ever evolving, changing every day. And to Roberto's credit, is a good, it's a tool to look at, but I'm just not, I think it needs to be vetted more, or just what, like Malcolm said, maybe you come up with your own group, and there's so many different models. I mean, it's like watching the weather over the years when they put up all the models when they're tracking a hurricane, and then it just looks like somebody dumped a pile of spaghetti on the screen. So you never know. So, I mean, that's my comment. Rita?
Yeah, I just want to comment on a couple things because they've come up. Firstly, I would definitely support Roberto letting us know who he needs to have access to as advisors. Again, I think as a select board, we get information from all different sources all the time. So I wouldn't consider this as any different from that. But I think in terms of, what we're going to really listen to, I think I'm fully supportive of Roberto telling us, who he needs to talk to and what resources he needs. The other question I had last Wednesday is that these sort of externalities or collateral damage of coronavirus, of the lockdown, it keeps coming up anecdotally. And while, we're here advocating, saying that numbers, don't pay too much attention to the numbers, I still think having some ongoing, consistent and regular understanding of how the numbers look different now as compared to last year or the year before. And I'm thinking about this, for public health purposes, so we can understand the impacts of our policy to the best that we can, but also as a select board member, potentially looking at a reallocation of resources where we can, if we can, towards some of these public health issues that are coming up out of it. So I don't think it's for naught. I don't think that we have to necessarily rely entirely on anecdote to say, we know it's an issue. We have organizations that can give us, even if it's a percentage increase. I think, to me, it might be tied to funding for that. Lastly, it seems like one of the most important elements of understanding the impact of the virus and how we deal with it has to do with the testing and tracing. It sounds like the hospital feels like they've got the tracing capability, but I'm wondering, as Governor Baker is putting such an emphasis on testing, how does that impact us? When will we be able to increase our testing? I think in terms of looking at the summer and what it might look like, it seems like the ability to test regularly is key to that. And I'm just wondering, what this status is for that.
Roberta?
To my knowledge, the testing standard is trying to get ramped up as much as possible. I know that there's been a lot of conversation about groups that are willing to donate testing kits, things like that. That's all conversations that we're going to have. Gary and I can have. I know, but a lot of the testing has to deal with what the expansion of the symptoms are. And recently this week, since they've expanded the testing capability, we're starting to see people come back to get tested. So as that case definition expansion happens, more testing will happen. We just unfortunately have to go by the rules of the case definition. It would be nice to be able to get every single person on the island tested, and I know that's a real big question right now. I know there's a big funding problem with it, and I know we are also looking to do some sort of a study of some seroprevalence of antibodies here. Seroprevalence is how common is the antibody available in the blood through the population. I know there's a lot of conversations to have a seroprevalence study done, and that is slow moving because if we're doing a study, you have to get it approved by an institutional review board, an IRB, you have to get funding, you have to have principal investigators, so on and so forth. So we are moving forward to expanding testing as much as possible. As far as Rita, the second concept that you were mentioning about the secondary effects of the lockdown, that is definitely something we're looking to look into. We're hearing anecdotally conversations of alcoholism is up, domestic violence is up, things like that, but we need to get that information. So I'm going to be reaching out to our on-island nonprofits that are mentioning those those statistics so we can get some hard numbers, what the percentage increase is in their phone calls and crisis response and things like that. But I would entertain any sort of, I guess the best word to say would be a motion, if that's what the board feels regarding this information. I will continue going forward, getting the correct information into the hands of the boards, plural, both boards, select board and Board of Health.
Does anybody want that motion?
Just
No, you're mute. You're muted. There you go.
I'm trying to understand what the motion for exactly.
The motion would be which, whether or not I should continue with this board. I mean, this advisory group.
Well, as I said before, and actually, Greg helped me formulate my opinion on this. I think there's nothing wrong with the advisory board, but that advisory board should be selected by you or the board or someone. And people on that present advisory board, they can come or go at your wish. But we do have to have a true cross-section. It doesn't have an appearance, at least, of a bias.
Excellent. Sounds good to me.
Great.
I don't want to speak for Roberto here, but that might be a bit much to put on one person. It puts him in a difficult position of having to say who gets to be on this board and who doesn't. And, certainly you'd give deference to his suggestions, but I would recommend that the board that the advisory board be constituted by a vote of this board.
Okay.
Does anybody have any other comments about that? You're muted again.
Malcolm, you're muted.
I'm sorry. So you're suggesting that if we have an advisory board, then people essentially apply and we would vote on it like we would any advisory board.
Rita?
That was my question, is whether it was an application process, and if so, then what's our time frame? But I also, we have the economic impact and recovery group as well that Janet, I'm not exactly sure how the composition was, who decided on the composition of that, but it is an excellent cross-section of town admin, stakeholders. I don't know if that's exactly applicable, but I think that one of the things that I'm a little bit concerned about is how each of these groups has come together very differently, and differing levels of transparency and process and who's on the group and who's not. So on one hand, I think that we want to do it the best way possible. But I just, again, we haven't done an application process, and all of that takes time. So I think that sounds like a very reasonable approach, but I think there may also be other ways to do it. Again, I don't know, Roberto, if you have thoughts. I agree, Greg, I don't want it to be burdensome for Roberto. If he can see how this would work, great. If he needs us to, if there needs to be an application process and have the Board of Health choose, that's fine too. I just want to point out that our other groups have not followed this process.
Colleen?
Yeah, I think an application process is going to take too much time. I would recommend that Roberto come up with a list of names that represent that cross section, and their credentials, and then present it to us for a final vote.
That's definitely possible. It's I'm just having a lot of trouble. It's like drinking from a fire hose right now. I think the best move for I think moving forward we can probably just what I'll do is I'm going to try to task staff to focus on the guidelines for the restaurants and and all the reopening procedures for the town, and I'm going to focus entirely on the epidemiology of this here on the island. And then if I need to reach out to anyone, I'm going to go ahead and reach out to as many of the academic institutions that I can so that we can get this from a proper source, journal articles, things like that, so I can give you the what are those words, the references and things like that, and we can go that way. I feel like this is moving so fast that to sit there and create a whole group that needs to be vetted and go through the whole process is just too much. So I think we can go forward the way it was 2 weeks ago now, where I was providing the updates, and I'll do what I can with a weekly update if the board is amenable to that. Kind of like the situation reports you've been getting from the EOC group.
EOC, yeah. Malcolm?
I'm sorry. I agree with Roberto. He's got enough on his plate. Mm-hmm. I think if he needs help, he'll call one of us. He'll call who he needs. He has contacts in the academic world. Some of other people have contacts in the academic world, but if he needs input, let him ask. Let him run it. Let him go himself. Otherwise, yeah, I agree.
Yeah.
We'll make this too complicated and too bureaucratic.
So we don't really need a motion to move forward in that, right?
Yeah, at this point, we'll just move forward the way we were 2 weeks ago. If as far as a liaison for help and stuff like that, I'll probably be calling you as needed. Malcolm, if I can bounce ideas off you from the academic and biostatistical standpoint, if you would be so obliged to help me on that, and then we'll just go forward.
Okay. So, are there any more comments on this, or we can move forward to anybody's comments on the construction phase 2? Seeing none, so we'll move on to, I don't want to have the meeting run too long with the 5 o'clock one coming, so we'll move on to the construction part, which would be order number 8, and just anybody jump in with whatever comments they had after they reviewed it.
I've got one question. Steve?
Go ahead, Jim.
On the second paragraph, it says the intent of this program is to allow the continued construction of any structures. So I want to understand that means not only what we started with, that were affordable housing and Nantucket year-round housing. This means any structure that had a permit issued before the 20th of March can now go forward to completion. Is that true?
Rita?
I get hung up on this each time. Does it have to fall within the safety, sanitation, essential? Does any of that apply, or is this literally any structure?
We cannot be less strict, and Greg, correct me if I'm wrong, we cannot be less strict than what the governor gives. So it still has to fit under the governor's order.
So what does that mean? That small paragraph. What does that mean by any structure that has a permit issued before the 20th of March?
That's a good question for this next meeting with Leslie. I think she'll be on there, Leslie and Paul, because that's definitely a point of clarification. We'll need from them.
Well, I mean, that's going to influence an awful lot of people on the island as far as the workforce is continued, because if it's just Nantucket housing, people that are Nantucket people here, or affordable housing, that work will be done in no time flat. So it's still going to leave people with no work at all. So I thought when I read this that I was looking at what they said, any structure, and I said, well, finally they're going to let any job that was started, they'd let it come to completion if they got the permit before the 20th of March. And seeing that that's what this says, I would like to know before we move on where we are with that.
Absolutely, and we're going to have representatives at the joint meeting with the select board from the Plus department to answer that question.
Well, then how can we vote on this?
We can vote. It's a joint meeting next. We can vote on it at that meeting as well.
Greg?
What you have in your packet is two different versions of this, right? So when we started working on phase 2, we came up with the amendments that you see starting on page 10 of the agenda packet. But if you scroll past that, starting on page, bear with me for one moment, please. Starting on page 19 is the second version. And I believe that language about any structure looks like was taken out. And what you'll see here is a more specific reference to the state standard, because I do agree with Roberto that while we can be more strict than the state, we cannot be less strict than the state. So when we say that we're phasing back in construction, we mean that we're phasing back to what the state allows. Now, come May 18th, the state may be allowing something completely different, but as of right now, the state's definition of construction is limited to residential construction or other types of construction that are necessary to maintaining safety, sanitation, and essential operation of residences. Now, it's my understanding that there is not uniform interpretation of the governor's order. And I do think that many communities and building officials have interpreted this order as allowing construction to go forward carte blanche. That is not my position. I think that if that were the intent of the order, you wouldn't need all of these words that are here. The order simply would have said construction. It doesn't. But it's really up to your enforcement department to decide, what's going to fit within that definition. But we did put the definition right in there, so there can't be any confusion as to whether we're being more or less stringent than the state.
Yeah, Roberto?
Thank you, Greg. One of the comments that was also brought up in conversation with staff, and I'm not exactly sure if I had sent an email out to the board or not, is the covenant housing. We don't currently, the permitting for the covenant housing and things like that got shut off as well, which is specifically for the affordable housing. And as written right now, covenant houses wouldn't be allowed to continue or get re-permitted. I feel like that would probably be a fair exemption to put in, as long as it doesn't run afoul of the governor's order. And I believe that because it's a specifically defined as affordable housing, I believe covenant housing would probably be considered doable. We just need to add an exemption for covenant housing into this.
Malcolm? Oh, you're muted again. You had it opposite. Yeah.
Am I talking?
Yes.
All right. I just want to roll back a little bit to the beginning of the meeting. And Roberto, could you repeat the number of workers that are infected on the island? And how does that relate to the timing of phase 1?
So I actually have a quick and dirty number here. So we have 13 cases on the island. Approximately a third of them are construction, painting, landscaping laborers of that sort. And then the over half of them are Hispanics on the island. So when we say about a third, it's about the number is 5. So that I believe there were two of the cases that came up after phase 1 started were workers.
I'm sorry, I got interrupted. So two of the cases are after phase 1 started.
Yes.
Thank you.
Rita?
So to clarify, we are sort of stalled around 10. Phase what happened, we had 3 more cases, 2 out of the 3. Is that correct? Okay.
Correct. Yes.
Anybody else?
Well, I just want to, so basically you're telling me the question I asked where it said any structure, that's going to be stricken from this. It's not going to be any structure. Is that what you're telling me?
I think we just need to wait for the answer on that from the Plus department. I don't know if we're going to be striking that at all. It's a conversation with Plus. I don't think that we'll be striking unless you want to strike it. This is a Board of Health order. If you want to strike it, you're allowed to strike it.
No, I want to leave it in. I want any structure to be left in there. Okay. But I want to know, I'm confused. What would you mean by any structure? Do you mean by any structure the housing you were talking about in the very beginning that was only affordable housing and Nantucket, year-round Nantucket jobs? Is that what we're talking about? Because if that's what you're talking about, this is completely different. This says any structure, and any structure, it says any structure that received a building permit before March 20th can now go forward. And I want to know if that's true. That's what it says on this piece of paper, and that's what I would like to see.
Greg, is that how it reads? Would that be allowed, or as long as it doesn't go run afoul of the governor's order?
So that sentence appears to have been taken out in the subsequent draft. Again, if you look at the draft on page 19. However, it was my understanding that the intent of phase 2 was to allow the continuation of any project that had a building permit prior to the state of emergency going into effect, assuming that project is allowed to continue under the state order. So the dividing line now is whether or not you had a building permit prior to, I forget the day in March, but March 10th or 20th, whatever the day is. If you had a building permit prior to that date, you can continue on with construction as long as that construction is authorized by the governor. However, no projects commencing after that date are going to be allowed. So if you have a new project or a new permit application, that project is not going to be allowed unless it fits within the emergency category. But if you started work before the state of emergency and you had a permit, then you can continue on, and there are no categories other than that, and other than the limitation that your work be authorized by the governor.
Correct. You just said it.
Okay, thank you.
Which to render the residents habitable. If you started something, stop, and now you can have the ability to render that building back to habitability.
Thank you very much.
No new construction.
That's right.
other sticking points that you?
We did send our comments into Roberto.
Roberto, yeah.
So, I mean, I think most of the questions revolved around the number of workers allowed. So I would assume Roberto has a consensus from what we sent in.
Yes, I believe so. The only two comments that I received were actually Steve's and Helene's.
Oh.
I got those to Gray. I believe that it's just the amount of workers.
Yeah.
We just need to kind of,
I mean,
we need to get a consensus on what that number is going to be.
The other question, I have another question. When you were talking about going up to 8 people, that 8 people didn't include landscapers. It just included going from 4 to 8 people in the construction part of it. Is that right?
I believe it's 8 people on the site. So that would be if there's 6 construction people, only 2 landscapers would be allowed on the site after that.
Okay, but it doesn't have to be 6 and 2. It can be any mixture of that 8.
I believe so.
Okay, thank you.
Malcolm,
I guess 4 or 8. I mean, it could be 5. It could be 6. It's arbitrary. And my concern is the timing of this order, and I'm uncomfortable supporting it happening very soon until we track the infection rate another week or 2.
Colleen?
I agree with Malcolm. I'm just going to quote Dr. Fauci from a few days ago, and he said, "Do not leapfrog," because my greatest concern is that we open things up and end up having to close down in July or August, and that would be catastrophic. I think slow and steady with surveillance and data collection.
Anybody else want to chime in? Yeah, this is something we can iron out in the next meeting for as far as numbers for Malcolm. Go ahead.
I think the numbers is an arbitrary swag. So I would again I cannot vote. I think at some point we should have phase 2 as it is written once you have all of these questions answered. But I can't vote for it happening until I have a better idea of the tracking of the number of cases for the next couple weeks. My opinion.
So as a heads up, as far as written goes, we also have a meeting scheduled for tomorrow, but we also have the joint meeting in about an hour. As far as tracking for those 2 weeks, we are now 2 weeks in, and we've only had those 3 cases.
We also have 345 tests, and that number has been growing, and 12 pending. So I think we just need a little more time.
That's just trying to provide the information. Absolutely correct.
Yep.
Jim?
My last question is, do you think that we still need 1 person per truck? You still want to keep that going? Do you think that's necessary now?
No, I don't. I wouldn't think it is. I think Jeff and the landscape part's going to 2.
Yeah, I would say if we go to 2 in the truck or at least in the cab, as long as PPE is worn, which is already in the governor's order. If you can't if you can't have 6 foot separation, I think that's the best way. They should be wearing PPE. But
Okay,
I don't see a problem there.
Thank you.
As far as what I said to Roberto, I mean, I like the idea that was brought up of maybe keeping it at 4 and with the ability to add to 8 if you really needed to, being more job specific. You know, you might have a bigger project, you need to have more bodies on the job. That was one of my comments. Rita?
Yeah, I don't know if Roberto is going to remember this at all, but I thought it was also interesting that I think there's currently about 195 permits out there, and that I think this would be opening it up to approximately 400 of the ones that they sort of know about. I think there's some time frame like November. So I think it's interesting. I know the select board was contemplating really 4 versus 8. One of the things that has been said a couple times by fellow board members is considering what this looks like, not as much worried about the timing of it, although again, we'll be having more state directives on the 18th, and I don't know which way it will go. So I don't know, to your point, Malcolm, what you're saying is really, you think whether it's 4 or 8, you think it's arbitrary. I don't know. I guess I don't fully understand your perspective on why that's arbitrary. So I'd be interested.
Well, well, I don't want to get back to numbers again, but where does the 8 come from? Where does the 4 come from? What is the information behind why we pick 4, why we pick 8, or why don't we pick 5.5, something like that? So I that's beyond my pay grade to determine whether it's 4 or 8. I'm just concerned about the timing period.
Rita?
No, I think that's a very good point. The 4, I think, came from a sort of building perspective when you're doing certain jobs, framing that you might need 4 people to be able to do those jobs. So from a sort of safety point of view, as opposed to a coronavirus related public health issue. But and the 8, again, I think is being sort of driven by a building perspective, and then the state being limited to 10. So thank you. I understand what you're saying now as to regards why you consider those arbitrary. Where did they come from? As I'm trying to think about it, it is this sense of it really comes down to, well, I don't know what it comes down to, but it's people in a room together using tools together, and the more people you have sharing tools, sharing spaces, depending on how well sort of that tolerable level of noncompliance. Are they wearing PPE all the time? Are they sanitizing things? And I guess we really don't know. Based on the board's discussion, I had been more comfortable with looking to the 4, broadening it a bit to the 4, but I think at the end of the day, I agree that seeing where this goes, particularly with 2 out of the 3 new cases, I don't know what to make of it. Roberto, you said we've only had 3 cases in 2 weeks, but 2 of the 3 were work related. So, I guess I err on the side of precaution and would agree with Helene and Malcolm.
Greg?
Just to give context to the numbers, there's no specific relevance to the number, whether it's 4 or 8. The relevance here is having a number, because the 2 things that you're trying to protect against here are a surge of workers to the island all at the same time, and so having an unlimited amount of workers on a work site is likely to lead to more people coming over all at the same time. The other relevance to the number, I think Rita touched upon, and that is keeping each job site to a small amount of workers, so that it limits the possibility of spreading amongst those on a particular job site, because it's not always going to be feasible to have PPE be worn to sanitize tools that are being shared. So while the number itself may seem a bit arbitrary, it's not arbitrary to establish some limitation for the reasons that I said.
Rita?
I have a question as well because I feel like all of a sudden we're bringing in the landscaping side of things, because right now my understanding is you could have 4 people working in construction on a project, and then 2 landscapers could come in. Is that correct? It's right now it's not limited to a number on a job site.
No, it's limited to a number on a job site. 2 landscapers right now can't come in.
If you have 4.
Right. It has to be all scheduled.
Already there. Okay. So it is keeping consistency there. Hmm.
I mean, in phase 2, if you went to a higher number, yeah, you could still have 4 construction guys and maybe 2 landscapers at the same time. And it's up to the COVID officer to schedule that all and who's going to be on his job site. It's, it's a lot of work, and the guys I've been around, they're doing it. Go ahead, Rita.
And that's just some of the conversations I've had were with people that felt that, there are people making an effort. 4 feels fairly manageable right now. I was probably talking to some of the smaller construction crews and tradesmen and women, but 4, and I think again trying to find a number that, when they're all feel somewhat arbitrary because we lack a lot of information, from the people that I spoke to, 4 seemed like a number that was manageable. But I don't know that if 2 landscapers showed up and you had 4 people working, I don't know that that's been in a house and on the construction side that the landscapers are going away. So I don't know that, the 6 on a property makes a difference.
Yeah. Helene?
Is there a reason we're being asked to make this decision now? I mean, the mayor's going to be issuing his orders in a week and a half, and we certainly will have a lot more information at our fingertips then. Is it possible to put it off until we have that information?
These orders are
for anything. I would say I'm one for moving forward. In these guidelines that we have in are still way more restrictive than what's going on across the pond in the rest of the state. Jim?
Getting back to what Rita said, I wouldn't mind seeing 4 people on the construction end of it and 2 people on the landscaping. The landscaping people would be outside, and 9 times out of 10, the 4 guys on the construction side would probably be inside. So I think you'd have that distancing. And if the 2 landscapers here's my question: if the 2 landscapers go and they get a permit to go to this certain house, and then the construction guys come and they want to get 4 people, how do they know that there's already 2 landscapers on that job and they'll only allow 2 construction people to go?
I think we're reading too much into it. It's going to be up to the contractor, COVID/COVID officer, depending on the number of people which can be on a job, to schedule how he's going to manage his job. He could have 2 plumbers there, 2 electricians, and if he is allowed 6 or 8, he could say, well, I need 2 landscapers are coming. It's a scheduling thing. At the point at what number of people we're going to allow at any given time on the job site.
Okay, thank you.
Anyone else? Any other comments on the construction part? I think all the other stuff was still the same protocol and stand down stuff. So if anybody doesn't have any other comments, do you want to just move right to the landscaping? Talk about that a little bit?
Okay, for me, I'm good.
Okay, we'll go to the landscape. Do you want to just introduce this part of it, Jeff, and tell us maybe what changed? And
Sure, I'd be happy to, just to kind of run through it in 60 seconds or less here.
yeah,
There aren't a lot of substantial changes from phase 1 to phase 2. The only activity that was added in, kind of based upon some comments through the hearing process before, is opening pools. I know there's been some concern about water sitting in those pools, especially as the water warms up. Other than that, there are no new activities included. The only other substantial change is an application process where companies can apply specifically for work that they believe to be within the scope of the governor's order for safety, sanitation, and essential operation of residences, for us to go out and actually physically inspect and review that and make a determination of whether or not we feel it meets that standard. That was put in based upon some projects we ran into where people were trying to set egresses into homes and wanted to do some kind of limited grading. We had a propane tank that slumped in that someone was concerned about getting fixed and contacted us. And I think we felt that having a little bit of ability to review those on a case-by-case basis would be helpful and provide at least a standard for people to apply to instead of just taking matters into their own hands and doing that work without permission or putting a landscape company in an uncomfortable situation to say that they're not willing to do it and then getting replaced, but to have a little bit of flexibility. And then the only other significant change to kind of come in line with the construction side is having a provision where there could be up to 4 workers on a site over 5,000 square feet, and a 5,000 square foot lot would still have a maximum of 2. The idea there is if you're a gnaw shop or somewhere like that where there's a smaller lot, you don't need 4 people. But if you're out at 285 Pulpus Road and it's a 5-acre site, there's plenty of opportunity to spread out and move around. And then the only other portion that's there, and this is a little bit of a part of one of our enforcement headaches, is allowing 2 folks in a vehicle as long as they're wearing PPE, because we're seeing a fair amount of unmarked trucks, I guess I'd say, with 2 folks in it, and it's difficult to distinguish whether they're landscaping or construction or some other service that's going around the island, and trying to make that a little easier to track and get a hold of, and deal with that there. Those are really the big changes for phase 2 that we're putting forward for landscaping, and happy to take any questions.
Malcolm?
Yes, thank you. You answered a question I was going to raise, and I was at a very large property 2 days ago, and you could have put 20 landscapers on that property, and they would have had more than adequate social distancing. So I think that's an important addition.
Yeah, I think that's something, and I tend to agree, and I apologize if I just interrupted, but that's something that we've been looking at, and that's how we wanted to keep that smaller provision, because I think we've heard loud and clear that we are trying to be sure that we're taking caution and doing this as best and as cautiously as we can, but still also trying to do a little bit of risk management at the same time. So that's kind of where we've looked. We've looked around for guidance from other states for what's going on. Again, this tends to be one of the more restrictive spots, so just trying to adapt to the environment here a little bit, and also addressing some of those concerns that we're hearing from both sides.
Anybody else? Rita, go ahead.
I don't really have a problem with the changes. I think some of the safety issues sort of at your discretion. I think that with landscaping, bumping it up to 4 people for X, thousands of square feet. With landscaping, the issue isn't really, when you're on gigantic properties, the ability to transmit. It's when you're in the truck. It's when you're getting your coffees. It's when you're helping each other lift things. So, I think it makes sense from that point of view. Again, as long as we're not going past the state, and as long as Roberto is, I really look to Roberto regards the 2 people per truck. And then Jeff, with the 2 people per truck, though, we can't actually pull anyone over. Do you sort of watch where they go to see if they're landscaping, or can we pull people over? Or how do you enforce that at all?
Sure. So the way that we've been doing it to this point, obviously, I don't want to say we follow people. Sometimes we do. A lot of times, especially if we know it's a marked vehicle, we've called the company directly and brought up issues, or we've dealt with it that way. We do get around if we see the direction that they're heading. A lot of times, like if we see that they're headed to Sconset, we'll kind of continue our round through Sconset and then swing back through again. When we locate that truck, we can speak to them then. But we don't have the ability, at least as far as Natural Resources Department goes, to physically pull somebody over as they're traveling down the road.
Rita?
And just to clarify now, with the governor's new order on face masks, it's not all landscapers should be wearing them at all times outside as well, correct? Or no? Because it's not public, it's private property. Okay, I'm just
Go ahead, Jeff.
No, I was going to say is I believe Steve shaking his head is correct that there are some provisions in there that allow there, but I would actually probably default to Roberto for how we're best to interpret that rule from the governor.
So as far as the interpretations of the rules from the governor, I think unfortunately a lot of times we end up having to do it on a case by case when we get something called in or something like that. But Jeff and I can look into it. I think when things come into the actual, where the rubber meets the road, having a blanket response is probably not the right response. We'll end up having to go case by case. But I do think that as things are going right now, I would just default to what we're doing, what Jeff and I are talking about already. I will look into this again and come up with some sort of a written interpretation that I can get to you before next meeting.
Okay. Greg?
Mr. Chair, so what the governor's order says is that you're required to wear a mask in a place that's open to the public in the Commonwealth, whether indoor or outdoor, and is unable to or does not maintain a distance of approximately 6 feet from every other person. There are other requirements that, people are required to wear masks at all times when inside grocery stores, pharmacy, and other retail, when they're inside taxis, cars, liveries, ride sharing. So I think that if you're on an outdoor job site and you are able to maintain 6 feet of personal separation, you are not necessarily required to be wearing a mask under the governor's order. However, if you cannot maintain that 6 feet of separation, then you are required to wear the mask, even if you're outside on a job site.
Anything else on the landscaping side? No, seeing none. I think that was that it, Roberto, on the agenda.
That's it. It's like a 25-minute reprieve.
Yeah, maybe we can get a little breather.
Yeah, just for the record, the phone call I took was one of personal nature, and no one was talking to me about the contents of the meeting.
Okay, so make a motion. We'll just end. I think right now we'll take can have a few minutes before the next meeting starts. Can I get a motion to close the meeting?
And so moved.
Second.
Seconded by Jerry. By roll call vote, please. When I call your name, Helene Weld.
Yes, aye.
Okay, James Cooper.
Yes.
Rita Higgins.
yes.
Malcolm McNabb.
Yes.
And Chair says yes. So